Thank you so much for coming. Thank you, Reverend Moore, for hosting us, for having us here this evening. I hope everyone's gotten some food and continue to snack and nibble because this is going to be casual, friendly, low-key. We're here tonight to talk about COVID. I also want to introduce Volunteers in Medicine. We've been a member of the community for 20 years now. We provide free health care for the uninsured. So our motto is neighbors caring for neighbors. We are volunteers that take care of anyone that doesn't have health insurance. Anne Marie is here tonight if anyone wants to register or ask questions about them, what we do, what we take care of. We have some of our friendly neighborhood agencies here. We've got the Department of Health, PRAC, Ascenda, Cape Hope, the NAACP. Please stop by and talk to everyone. Tonight is really just about community and neighbors. So I want to get us started because we're here to talk about COVID. We have a fabulous panel. At that end, we have Mary Kai. Mary is a nurse. She's with the Department of Health. She is administered 25,000 vaccines in the last year or so. So you got questions, she's got answers. Reverend Moore, you're gonna tell them who you are because I'm sure they all know you.
Didn't know me. Didn't know me.
Dr. Lynn Helmer is our medical director. She does free care at the VIM clinic every Monday. Our patients love her. Her staff loves her. If you've got questions, she's also got answers. And Jennifer Plews on the end is with Ascenda. Those of us that have lived in the county for a long time know them as Cape Counseling, but they are Ascenda. And Jen is mental health and acute care. And this has been a crazy 2 years. So we have, any question is on the table. The only thing I ask is that we stay friendly and respectful. Everyone should know where the exits are in case of an emergency. I am going to sit down, give the microphone to Pastor Moore. I'm also going to introduce one last person, our community health worker, Jessie.
Hello, everybody.
Jessie is bilingual, so if anyone is more comfortable speaking in Spanish, she'll translate for you. She's going to ask the questions. She's going to come to you with the microphone. She's our man on the street, right?
Grace and peace, and I just want to welcome you. Thank you for coming out. Let me take my mask off. I am vaccinated and boosted. Just want to thank you for coming out to this most important session. Very often in the church they have a saying about preachers preaching to the choir. So we don't know exactly what we're entering into if everybody is vaccinated and we're all on one accord in that regard. And if that's the case, then it's just like when you come to church. You come to church to get full. You come to church to get encouraged so you can go back out and serve. So if that's the place that you are in, you're vaccinated, you're covered, you're good, you want to get a booster, you need to get a booster, that's great. But you can also hopefully get some good information that you can take back to your family members, your friends, and those whom you know and love who are, might have a little hesitancy when it comes to the vaccination. If you have not yet been vaccinated, I would just ask you to meditate on the number 1 million. 1 million people have died from COVID thus far. 1 million people have died from COVID thus far. And African Americans and members of the Latino community, we are disproportionately affected by COVID. So it's really a literal matter of life and death. Even when we survive, we have more complications and more challenges. And I'm getting that look from my wife like, yeah, you are a Baptist. So I'm going to stop talking. I'm going to stop talking and pass the mic to Jesse. I'm sorry, Jesse.
No problem.
Okay, so I'm going to start off with a few questions that I've heard, a few rumors that I've heard about, to kind of get it rolling, and then once we start off, then you guys, that'll go towards your guys' questions and concerns, so that everybody hopefully gets some kind of answer for any question or concern they may have. Okay, so let's begin with you, Reverend Mark.
Okay.
So I have heard, one of the rumors that I've heard is that the COVID-19 vaccine can actually alter your DNA. Can you help us understand that a little bit better?
Well, I'm not a medical professional, but all of the reading that I've done. Oh, yeah, thank you. I'm not a medical professional, but all the reading that I've done and speaking to other doctors and members of the health community, that is patently false. It does not alter your DNA in any way, shape, or form, according to the medical professionals that I have spoken to. And I have vaccinated and boosted and all that good stuff, but no, it does not alter your DNA.
Perfect, thank you.
No problem.
Thank you for that. Now, Dr. Hubbard, my friends are afraid that by getting the COVID-19 vaccine, they will get sick or get the virus from the vaccine. Can you ease their fears?
Sure. Absolutely, and like the Reverend, I am vaccinated and boosted, as is my entire family, and I like my family. So just so that you know, that's kind of what we're doing. So I just want to be clear, Jesse, because patients have asked me that a few times, and they mean two different things. So can the COVID vaccine give you COVID? Absolutely not, okay? It absolutely cannot give you COVID. There is no virus in the vaccine. That is not how they work. So it is absolutely impossible for you to get COVID from the vaccine, from any of the vaccines available in this country, okay? The second part is, can it make you sick? And if you mean, can I feel lousy after I get the shot because I have side effects? Yes, you can have side effects. Most people are going to feel a little tired, maybe have a sore arm or a little red spot or a headache, maybe fever. Some other people may feel achy or even a little worse than that for a few days. Most people, it's over in 1 to 2 days or less, and the symptoms are taken care of just fine with ice on your arm, which everybody forgets, but it really works, okay, and Tylenol. The other thing to remember is that COVID will make you sick for a whole lot longer, okay? So it is definitely, vaccines cannot give you COVID, and if by sick you mean, can I have a few side effects? Yes, they are most likely going to be mild, and it is much shorter and much easier than actually getting COVID.
And that's, I want to just expand on that a little bit. That is actually a normal immunity reaction. That is our bodies are a wonderful thing. And that is actually your immune system working. That means that, if you don't get it, it doesn't mean that it's not working, but if you have those side effects, that's your immune system. That's all your antibodies starting to rev up and work in your system. So that's why you're feeling that. Because that's the same thing can happen after any kind of immunization. Flu shot, pneumonia shot, any of those. We always sort of tell you, you can feel, typically we'll just say, you'll feel punky for the next day or two. You might not feel right. That's your immune system revving up and everything. So that's a good thing to have.
Thank you for that. Now, Mary, what can you tell us about the rumor on the COVID-19 vaccines carrying microchips?
I know where every one of you are. I'm kidding. So that isn't true. That is actually something that they can actually track that back to one particular conspiracy theorist person that they were putting chips in so they could track us and all that kind of stuff. And it is not true. I've read all the ingredients that are in both or all three vaccines that we give here, the Pfizer, Moderna, and J&J, and there's no chips or anything like that. We certainly did not have, as quickly as the vaccine was developed, they certainly didn't have time to come up with that too and get that out. So there are no microchips in the thing. Nobody's being tracked and all of that. The vaccine is safe. We just want people to stay alive and try and stay healthy. And if they do get sick, at least have a fighting chance and not end up in the hospital.
Thank you. And Jennifer, we have heard that the vaccine was developed too quickly. Is it safe for us? What was the time frame so quick? How can you ease us on that even though it was a quick distribution of the vaccines, it is safe for us to take?
I'm not sure if I'm an expert at answering that part of it. I do know that it was developed rather quickly, and being a mother of 3 small children, I certainly did my research and talked to my primary care and my pediatrician and had a lot of questions and concerns about that. My children are vaccinated, and you know, there was definitely that fear inside of me personally, but I felt like the benefits definitely outweighed the, you know, any fears that I may have had. My children have received all their vaccines through all of their years, so I don't really, you know, from a mental health perspective, I know that we've talked to people, I know that that's been a concern, I know that we've seen an increase in anxiety and things of that nature, and as professionals we try to, you know, address that and see where that's coming from.
Can I answer that?
Yeah, sure.
So, you know, I think that's a really fair question because these vaccines happen, very quickly. But what everybody needs to understand is that there are certain phases of drug development, so phase 1, phase 2, and phase 3, before drugs are released or vaccines to the public. And what usually happens is that the drug does phase 1, the early thing, and then if that turns out okay, then the drug goes on to the next step. And then if that turns out okay, then it goes to the 3rd step. And if that turns out okay, then, you know, it comes into all of us. That's sort of simple version. In most cases, the drug companies do these things one at a time. So they do phase 1 because if the drug fails, then they just throw it out and quit, okay? And so usually one of the reasons that it takes longer is because they do step 1 first, and then step 2, and then step 3. In this case, the government funded the drug companies to take a risk and do several of the steps together and also make a lot of vaccine before it was approved. And the risk was that if one of the tests turned out to fail, they were going to throw it all out and waste all the money, okay? And normally a drug company wouldn't take that kind of a risk. But because this was, you know, a crisis, the government funded all of this, took the financial risk out of it for the drug companies, but every one of the usual steps was done. So it was faster because of the things I mentioned, and you know, essentially the government and us through our tax dollars taking on the financial risk because this was an unusual situation and we wanted to save lives. But there were no steps skipped, there were no safety maneuvers that didn't happen. And as I said, I am 100% confident that these are safe and that there were no shortcuts.
Oh my gosh.
Thank you. All right, does anybody want to start off with some questions or concerns that you would like to ask? I got one hand up first and I'm coming to you.
My name is Dr. Julia Hankerson. I'm on the board of directors for Volunteers in Medicine, and I'm a psychotherapist. And one of the issues that I've constantly had to field with some of my clients is when they're dealing with their children, their child is not going to be able to have babies because of the vaccine. That's one. See if I can remember the other one. And the other one is it's going to cause their child to have a cardiac issue. And anybody can answer that for me.
Well, you know, we have a partner over there with Mary. Thanks, Julia. So people have looked very closely at the issues of pregnancy and children because that's something that we all care about. There is absolutely no data that being vaccinated poses a risk to a pregnant woman or to the baby. And in fact, pregnancy complications from COVID absolutely happen and pose a risk. So pregnant women and women anticipating pregnancy are strongly, strongly recommended to get the vaccine. It protects both the baby and the mother. So that's one. And the other one was that they were right. So the cardiovascular thing is a little bit more complicated, and I think that that has gotten confused. So the first part of this is that there are some cardiovascular risks that occur with the messenger RNA vaccines, possibly, though not definitely, a little bit more with one than the other. The studies are inconsistent. And a number of times this has happened is very, very, very low, but has been, as more and more people have gotten the vaccine, a little bit more common than we thought in the beginning. It is still extremely rare. It is most commonly in youngish men, okay? And the vast majority of them have been fine within a couple of days. A few have been hospitalized, and at the moment, virtually none have had any long-term side effects that have been known. The other thing, and this is a conversation I have all the time, is that you're not comparing the vaccine to nothing, because obviously if nothing's going to happen, none of us want medicine. I mean, of course not. So what you're doing is you're comparing the vaccine to the disease. And this cardiac question that Dr. Hankerson is asking is much more common and severe with COVID, the disease, than it is with the vaccine. And that's what people need to remember. Okay. There's also been, I'm sorry, one last thing, a change in the recommendation of the timing of the second vaccine for that risk group, so that maybe if essentially the younger men primarily spread out their second dose a little bit more, so instead of 4 weeks they go to 8, that might decrease the risk even further. But it is a very, very small risk, although it is there, and it is much smaller with the vaccine than it actually is with COVID.
Thank you.
I don't need the mic.
You don't need, okay.
What if someone tested positive on your job and you were with them or in the building? So, like, what's the protocol on that?
So, if someone is positive that you know, let's say Pastor Moore is positive, tomorrow he comes up positive, and I'm sitting next to him and all that kind of stuff. You kind of have to take in where you're at. Are you vaccinated? That would be the first thing. If you're vaccinated and boosted, your risk is decreased, but it's not no risk. And how much time were we spending together, and how close were we? What kind of activity were we doing? So just sitting next to him and all that kind of stuff, it increases my risk a little bit because he's now positive. But the longer we spend together, the higher the risk is. So, but if you're boosted and you're vaccinated, your risk is a little lower than someone who is unvaccinated. So really what you should do is monitor yourself whether you're vaccinated or not vaccinated. But if you're not vaccinated, you should quarantine. If you know you've been in contact with someone that's positive, you should quarantine for 5 days and monitor for symptoms. If you don't have any symptoms, then you're good to go. Wear a mask for the next 5 days. If you're vaccinated and boosted, you don't need to quarantine, but you should be monitoring yourself for symptoms. If you start with one little sniffle and sneeze, and it's hard to tell because it's flu season, it's still flu season, unfortunately, right now, which is unusual, but it's also allergy season. And a lot of the very similar symptoms and all of that. So, but you know now your risk is higher because you've been in contact with a positive person. Do a home test. Check. If you start with symptoms, the home tests are around, or to get those, you can still apply through the government to get the 4 free sent to your house. You can through your insurances. A lot of the insurances will pay for 4 to 6 of the home tests, or they're not super expensive. If you got the money, you can go grab one. You can go get tested, if you're not feeling good and all of that, you can go get checked out at urgent care or your primary physician. A lot of them are testing now and all that. But I would recommend getting tested if you've been around a positive person and you start not feeling well. Definitely test yourself, whether it's a home test or a regular test.
Within contact with a positive person, how long should you wait before you get tested?
So, with the new Omicron variants that are out, Omicron itself and now the variant of Omicron, it actually takes effect pretty quickly. So we usually say you should test like in that 3 to 5 day range after you've been exposed. It's always good. If you want to do, I wouldn't do it too much earlier because you'll probably get a negative and you're not sure. I mean, I've had a couple people, they're like, well, I tested the next day and I was negative, but then 2 days later I was sick. So we usually say in that 3 to 5 day range test with the new variants that are out. Before we were saying in that 5 to 7 day range when we were with the original COVID, but now with these variants, it's very, very contagious.
Thank you.
Thank you. All right.
Sure. So how accurate are the home tests?
The home test? Dr. Helmer, what do you think?
Sure. So
they can hear you confident in them.
yeah, I know. You have a big mouth, and they keep giving me the mic. I don't get it. Anyway, anyway, so the answer is it depends. But if they have an emergency use authorization from the FDA, they're pretty good. And if you have symptoms, they're pretty good. Okay. And if you were exposed, you have a home test and it's negative, what I would recommend is that you do it again a day or 2 later if you really had an exposure or if you're really concerned. And they're not 100%. So if you're really worried, if you really had an exposure, if you really just don't feel good and maybe you live with somebody high risk or you're about to go visit somebody high risk, then I would go and get a PCR. But if you don't have a really high level of concern or a really good story, the home tests are fine. And if you do it 1 or 2 in a row, that ups the accuracy.
And I'll use my own story as an example. I started not feeling well on a Tuesday night into a Wednesday morning. Wednesday morning, I took a home test and it was negative. I went to work. As Wednesday went on, I started still not feeling all that well and feeling a little worse. I tested again Thursday morning. I was then positive. So I don't know what my exposure was because I didn't have a known positive, I wasn't around somebody that I knew that was positive. So I didn't know. But that's why it's always, you've got, like she said, the symptoms. You really got to base it on the symptoms. And I started and I thought it was allergies and all of that, which, like I said, right now it's a tough time between flu and allergies and COVID. So, but it's hard to tell sometimes. But as I started not continuing to not feel well, it started feeling different from my usual allergies, and that's why I retested again, and then it came back positive. But no one at work amazingly, no one at work else turned positive.
I just want to add too, because it's a little confusing, that once someone in your household has COVID, okay, the other people in the household also need to check on themselves because they could be asymptomatic, and the math gets kind of confusing. So you should test at any point when you don't feel well, or probably, within a couple of days after you're exposed, but your real exposure, where you start counting again, is the day that person comes out of isolation. So if my husband has COVID and, you know, I test when he does because we don't know where he got it from and I'm fine, and then he's out of isolation in 5 days, my last exposure was that 5th day, and I need to check, I need to be careful till day 10. So it's kind of confusing with household contacts. So if any of you are in that circumstance, I would recommend that you call your provider or, you know, just Google for the CDC what to do with a household contact.
Or call the health department.
Or call the health department, sorry.
We'll answer your questions.
And as a commercial, they are the most, and she did not pay me for this, they are the most amazing health department I have ever worked with. And I've worked with a bunch. They are unbelievable. So if you need help, call them.
All right, and then we had one in the back.
Way in the back. Cookie.
I just have one question. Some people is coming in and asking some certain things. I'm the first time to see it. My question is, how many times can you catch the COVID? You know, so you don't know who's contacting you, you don't know who's been around. But how many times can you get down sick with the COVID? Because I know people that's had it more than twice already.
So that's based on what they've been exposed to. So we went through, we've gone through multiple variants. So so we had the original COVID strand, and it has changed a little bit each time, and so you can be exposed to the different variants and get the different variants. So the biggest one that we saw where people were going into their second round of COVID was they had Delta, and then we had the Delta floating around for quite a while, many like 8 months, 9 months. Then Omicron around Christmas time came out, which was a different variant, so it was a little different than Delta. So I know people that had Delta and then turned around and ended up positive with the Omicron. They were not that sick with it, but because they had only 5-6 months ago had Delta and then ended up with it. So you can get it multiple times as the different variants come out. But the thing that the vaccine does, and I want to go back to the vaccine, that it is a good thing, because if you look at our numbers in Cape May County, I mean, I've been deep in these numbers day in and day out for 2.5 years now, and you know, we had lots of sick, severely sick people in the beginning with regular COVID. Then the vaccines came out. We had some still severely sick people, but as we've gotten vaccinated and boosted, those numbers have dropped significantly. Our hospital numbers have dropped significantly. Our deaths, if you hear the news, the death numbers are going down dramatically, because the majority of, we have a good number of vaccinated people in the United States. We have a great number of vaccinated people in Cape May County. So because of that, our hospital has, I can tell you, I just looked up the numbers the other day. So in the last 2 weeks, we've had 4 was the number, total max number that we had in the hospital at one point within the last 2 weeks. We're now at 3 and 4. Yesterday was 3, today's 4. We've been running at 0 and 1 consistently for days, and just recently we jumped up a little bit in the numbers. For 2 weeks now, we've had nobody in ICU, nobody vented because of COVID, and we've had 1 death in the last 2 weeks, and that was a death in the community.
So you're saying that every time that a different one comes, we have to get vaccinated again, keep from catching the virus again?
You don't necessarily need to get vaccinated again, but this is why we're doing the boosters, because you have antibodies still floating around in your body from the last time we were vaccinated. But what's happening is those neutralizing antibodies, after so much time, they start to decrease. And as they decrease, that now increases our risk of, if we're exposed, getting sick. But what the vaccine is doing is it's really protecting us from that severe illness and ending up in the hospital type. But we're still, now the breakthrough cases we're still getting, because of the variants, we're getting a little bit away from the original strand, and that's why we're still getting sick, but we have cross immunity from the original vaccine.
If I could add to that, I think, it is clear that some people can and do get COVID more than once, and some people are unlucky and they get it more than that. Most people don't. And the vaccines, were designed, the antibody and the virus thing is kind of like a key that, that fits into a lock. And so the original ones, it was like a perfect fit, okay, because they were designed for that. Now it kind of wiggles a little bit, okay? So it's not quite a perfect fit. So the not quite a perfect fit is what you see as the breakthrough cases. But the vaccines are still really, really good, okay, depending on who you look at, between 70 and 90%, depending which study, protecting people from severe hospitalization and death. And they're never going to be 100% effective at protecting you from anything. So, will there be more vaccines? I'm not a betting lady, but my bet would be yes. Do I think the most likely thing, and this is a guess, okay? If I knew, I would tell you I knew. I'm guessing, I'm telling you I'm guessing, is that you're probably going to need a vaccine every year. And it's probably going to be tweaked a little bit for whatever is in the neighborhood. That's a guess, kind of like the flu vaccine. It's probably going to become not a big deal as long as all of us get vaccinated and kind of, do the recommended stuff. So it's not like everybody's going to get horribly sick all the time, but there are going to be some changes in the vaccine and there are going to be some changes in the virus, because that's what they do.
So every time we have to change in the virus to get a vaccine,
No.
we have to get another booster shot also.
No. A lot of the times the vaccines are going to work for multiple variants.
Okay.
Which is, I think, your question, right? So yes, you will not need a different vaccine every time.
Okay. Thank you.
Sure.
Go for it. Icy. Go for it, Icy.
Question about the mask. Do you think that we should still wear a mask? I know common sense says so. And when we're in crowded areas, even though mandates have been taken away, would that cut down on the virus itself? I'm asking, I'm not.
Well, I think what the answer is yes. And if you look at the CDC numbers, they actually give you guidance on when you need to wear a mask and when you don't. And the higher the community level is, when it's the highest level, you should wear it all the time. When you're indoors, particularly, period. When it's medium, it depends who you're with and what your own personal status is. My own practice is, if it's with my family, and I know everybody's vaccinated and boosted and nobody's been exposed to anything, we'll be unmasked. We will still leave windows open, by the way, all right, because ventilation is really important. If I'm in an indoor space with people that I don't know, I wear a mask. And, especially when it's above a low level. And for what kind of mask, you have a little bit of flexibility there. And there's some argument. The N95s or the KN95s are the most protective. They are also uncomfortable. And if you have the best mask in the world, but you're wearing it kind of like this, it's not doing much for you. So
No mask there.
right. So you want to wear the best mask that you can wear that you're actually going to wear. And for me, if I'm in a really high risk environment, like in the clinic with patients, I wear an N95. If I'm in a less tightly packed, or if I'm not in a high community area where I'm less worried, then I would not be as worried about wearing a super tight fitting mask. So you have some choices. What I tell people is, if you're not sure, if it goes through your mind, maybe I should wear a mask, wear a mask. I don't know if Mary would add to that.
Yeah. Yeah, I think, and I totally agree with Dr. Helmer about the mask thing. It's very important when you're in a crowded area. You think of a concert situation or something like that. You have no idea around you who, what, when, or where is going on. So a mask in that situation is a good thing. But outdoors, you've got air flowing, that's a good thing. You might not need a mask, but if you're in a tight, you're going into a concert and you're all packed in like cows going to slaughter or something like that, then you're going to want to wear a mask. So I know they're uncomfortable. I know I love taking off my mask at the end of the day and stuff like that, but it really is for your protection, and it also depends on you personally, your health, what's going on with your health and stuff like that. If you're someone that's immunocompromised, then definitely, and someone who's, you're worn down. And we have different times that, I know, there's months that I'm just a little more busy and I'm not taking care, I'm not eating right, I'm not doing this. I'm worn down a little more than normal. Probably should have a mask on just to protect myself and anybody else.
I was just going to chime in because I'm not a medical professional, but I'm a school teacher. And I teach at what I describe as a very public high school in North Jersey. And we recently relaxed our mask wearing requirement, which I never did. I kept my mask on. And just in the past several weeks, yesterday, and our high school's big, it's about 2,000 students, but yesterday 15 kids tested positive for COVID. The week before that, 20 kids tested positive for COVID. I bet when I get home and if I check my school email, I'll get another email saying another X amount of students, tested positive for COVID. I just, just as a pragmatic practice, I just wear my mask. I'm a diabetic. I have high blood pressure, so I don't blame. I think it's just not worth it given the risks.
I just want to also add that masks protect the wearer. They also protect the other guy. I can't tell from looking, and neither can you, who's at risk. Sometimes it's obvious, but sometimes it really isn't. So I think it's a kind thing to wear it to protect the person that you don't know might need your help.
I have a question. Do you think they're gonna change the unmasked rules and start to, tell people that they need to wear their mask? Because we have people in our workplace that are just walking around with no mask, and they're younger, and they don't think a thing about it. I mean, it's really, a little scary when they're just walking around, and they're not vaccinated, and they just.
So, unfortunately, and you and I were talking about this earlier, that has become more of a political question than a medical question, and that offends me to my core. So, let's just leave it at that. It should be a medical issue, and it has become a political one. So I think, you have to do what you have to do to protect yourself, because my guess is that the government may make recommendations, but it's probably going to wait a while to make mandates, if ever. So I would be looking at the recommendations. I would go to the people or groups that you trust, that you think are knowledgeable and that share your values, because you will absolutely get different advice from different places. And that's confusing. It's confusing to all of us. So I think you have to handle it that way. I think there will be more recommendations. I think mandates will be slow to come. And I won't get into whether that's right or wrong, but I think that's what's going to happen.
Thank you.
Well, we'll use the airlines as a perfect example that's currently going on right now. They just released the airlines from mandating that the masks be worn. Some airlines have kept it, most have not. But yet the CDC just on May 3rd put out a very strong recommendation that they still recommend that anybody that is traveling and in an airport or any kind of public transportation wear a mask while they're doing that. So that was some, you know, just like that was a political versus health thing that happened. So you have the CDC that say, we don't like what the court said and it's not following the science, so we're going to put this recommendation out and make it strong and all that kind of stuff. But, you know, some are following it, some aren't.
Thank you.
I know we're in what, third year going in, second year. Doctor, could you speak on herd immunity?
Sure. We have a pretty small herd. About 60% of adults in this country are believed to have had COVID, whether or not they were vaccinated. And that number comes from, as you may or may not know, some of the antibody blood tests that are sold to you all, and which I strongly recommend you do not waste your money on, can be positive because you were vaccinated or because you had natural disease, because you get antibodies from the vaccine also. But there are antibodies that can be tested for that are only from natural disease. And so in certain settings, they can tell the difference. So that's where that number comes from. So about 60% of adults, about 75% of children seem to have some immunity. What we don't know is how long it's going to last, what the right number is to protect everybody. And from way back, there was this conversation that the more contagious the variants are, the higher level of herd immunity you need to protect everybody. So I think that conversation is kind of, I would almost say, getting a little bit outdated in a way. And of course, to the lady in the back who was talking about variants, you know, you could be protected against this, but not as protected against that. So it's an interesting idea. We are approaching, you know, higher numbers, especially in the kids, and I think it's not going to be a way in the near future to make a lot of decisions. I will also say that, and I think Mary would agree, a lot of what we're saying is, I guess, based on what we know now, because the situation does change quickly and the knowledge does change quickly, and that's what happens when you get a new disease. It's not like it's a weird new thing for COVID, it's just weird because we're all talking about it all the time. Okay, but this has happened with other diseases too.
Anybody else have questions?
Right over here.
Hi. That's what I have a question. I got COVID back 2 months ago. And I was impressed that the state called me immediately the day I came home from the ER. I was really surprised. And I was in bed, and they said that there's a way of tracking if you're exposed to someone else who has COVID. And I wasn't quite sure I understood what they were talking about. And it's only for a short period of time. Do you know anything about that?
It is. So it's called New Jersey Alert. So what happens is if someone, and it's a new emerging sort of technology, and it has to do with your cell phone. So those that were positive, so we'll say, and it's only people that participate in it, which makes it a little bit flawed, but those that were positive, we asked when we were doing the contact tracing and all of that, we would ask you if you were willing to participate in all of that. And it was about 50-50, half and half would, half wouldn't. And so while you were on your 10-day isolation at that point in time, if you said that you would participate, if the pastor had his phone turned on to alerts, and I said I would participate, and they now have because I would give my cell phone number, they would do it, then it would, if I came in contact with him and he was participating in it, because he turned on his alert, it would alert his phone that he wouldn't alert that it was me, but it would alert that there was within a certain radius a positive person. So it would alert him, and new, and it's technology that they're starting to use, and it was something, you know, we're trying. So there were a lot of fails to it, because it is new, and we're trying to learn, because it's only if somebody participated. So and like I said, it was about 50-50. So if someone wasn't participating, then it doesn't help. But that's technology that's still emerging and all that kind of stuff. So it was sort of like a little alert system.
Okay. And there was someone.
There's some little lady right here.
Hi. I've had the shingles, so now I need the Shingrix vaccine. Do you know anything about getting that vaccine with the 4th booster? Is there any time thing or anything like that?
Not anymore.
No, your question is a good one, which is, can you get the Shingrix vaccine and the COVID booster at the same time? And early days, there were a lot of restrictions about what you could do at the same time and how much. Now there are none. So feel free.
So any vaccine with the COVID vaccine?
As long as it's not alive.
As long as it's not live, which would be unusual to come up.
Okay.
Any other questions?
So I have a question for Jennifer, just because no one's hit you up, is.
It's okay.
I know, but it has been a scary and a frustrating couple of years. And I think everyone's stressed about their kids, about whether or not you can, what can you enlighten us about?
It's a great question, and you are absolutely correct. You know, I was excited to sit on this panel, not so much to answer questions specific about COVID, but to really address a lot of the mental health issues that are coming out of what we see with COVID. And there are a lot of them. You know, we are seeing, you know, children really struggle, parents struggle, people struggling with isolation, people struggling with anxiety to have to go back out into a community. My recommendation is get help early. You know, if you're not feeling well, if you are not feeling mentally healthy, it's really important to get help as soon as you can. You know, mental health is definitely something that is growing through our population. We have a lot of wonderful services and programs down here to help. One that will, sorry, my mask keeps falling down. One that will be starting soon is a mental health urgent care, and that will be opening down here within the next couple months. So there's really no barriers into getting treatment. When we teach and when we talk about mental health at different symposiums and different panels, you know, we really try to make sure that you understand, you know, New Jersey is a state of prevention. We really want people to get help before it manifests too long and really starts to get worse. You know, our recommendation is to get help before a crisis happens or before you feel like it's too late. And there is help out there. I can't stress that enough. I know sometimes the mental health system is very difficult to navigate it. Trust me, I know. I live in it. I've lived in it for over 17 years, so I know that it can be really difficult to navigate for families and for loved ones. There is a lot of help out there. There are a lot of resources, and my recommendation would just to really get help. There's a lot of people struggling right now. You're not alone, I will say that, and there's definitely, what I love seeing is the people that are reaching out and are asking for help and are inquiring on how to get it.
And we tend to forget about that side of things.
Absolutely.
I mean, that's a very important part of your life, your mental health. I mean, if you're stressed, it affects the rest of you. It affects your blood pressure. It affects your behavior. It affects how you interact with people. And then it just like comes full circle. So that, you know, we need to continue to think about that part also with everything that's going on with the isolation, like she said. You know, so one of the things that, you know, nobody likes to talk about, but, you know, we've seen an increase in the drug issue going on in this county through COVID. It has, and not just here in Caton County, it's throughout the whole United States, but especially throughout New Jersey. But, you know, we're feeling it here too. There's, you know, you're isolated, you're sitting at home, you didn't have a job, you lost your job, you can't get a job, you know. And some people just don't know, and there's the mental health part, don't know where to turn, and they're depressed and they're anxious and all of that, and unfortunately, you know, they turn to the dark side and turn to drugs to try and help them, and it's sad, but there is help out there, and you know, access it if you can. If you know somebody, help them. Send them, you know. If you don't know how to help them, reach out to somebody else and see if they know how to help them.
Oh, could I?
Absolutely.
Since we're also, you know, since we're talking about children, I also deem it appropriate to talk about teachers, because teachers, we spend, you know, anywhere from roughly 30 hours plus with your children. And we all know how COVID has turned instruction upside down, virtual learning. You know, now we're in the classroom, mask, no mask. This kid's quarantined, so he has to be virtual or she has to be virtual. I would just, you know, as a teacher, I know we have another teacher in the room, you know, support your teachers, support your child's teachers. Check in on them. I mean, it's Teacher Appreciation Week. We talk about how we love and appreciate our teachers. We bake them some cookies, give them some bagels, and then when something goes a little left, we're on the phone cussing them out. And that should, I'm just gonna be real. And that shouldn't be. You know, you have to be mindful that even though we're back, and some students, I mean, some schools don't, you know, you don't have to wear a mask and this, that, and the third. A lot of things are still very tense, very difficult. I have students who are just really starting to share now, and it's not due to a lack of engagement like Jennifer was talking about with the mental health component, but they're just coming out of their, you know, their shell now. They have stuff going on at home. You know, COVID has affected a lot of households economically. So the kids are stressed because they're feeling their parents' stress. You know, administrators in schools, you know, they used to be able to do their jobs. Now all of our administrators are doing contact tracing. So they're not getting into the classrooms to observe this and that and things. So it's very important that you stay connected to your children, that you engage them, check in on them, but also support your children's teachers, because they need it.
I think that's, you know, as he's talking, I just, one more thing, in address with mental health, we need to remember to really take care of each other. You know, we're a community. We are facing challenges every day, whether it's sickness, whether it's COVID, whether it's mental health or physical health. We really need to take that approach and take care of each other as a community.
And I just want to add to that the obvious, which is that when you are not vaccinated, you are putting other people at risk, and particularly the people that we've been talking about, teachers, healthcare workers, the people that are looking after our children, and they're exhausted. I mean, they are exhausted. And we need to look at, one of the ways to look out for them is all the other things that we've been talking about, which is a real concrete way to support them, probably even better than bagels. But seriously, you know, the mental health issues are real, and you know, as people get long COVID, their struggles are going to go on. Chronic disease is a major stressor, and so, you know, really think about this vaccine and this self-care and this protecting others, because it makes a big difference for all of us in the community that we live in.
Yeah, absolutely.
All right, thank you all for that. Did anybody else want to add anything or have any additional questions to ask? No?
We got plenty of food still to eat.
Yes, there's walking tacos, we have hot dogs, we have mini tacos, mini empanadas.
All healthy stuff.
I also just want to give a plug to the health department as far as for vaccines. We have a mobile clinic at least once a week. We're out in the community in different areas. If someone is homebound and can't get out, please call the health department. We can get to you. We do have a way to do that. So, you know, if you have someone at home that can't get out, let us know. If you have a neighbor, maybe you know a neighbor that can't get out, let us know, and we will bring the vaccine to them. Thank you.
Just real quick also, Ascendant is here, the table back there is specifically for our ICOM Well program. A lot of the conversations that we've been having today is about the effects of COVID and how disproportionately they are to specific races and demographics. The ICOM Well program is a special funded program from SAMHSA to address and break down any barriers that you may be experiencing for mental health or any type of social determinant of health. So please reach out if you need anything.
Thank you.